A patient in 17th century Europe. A large tumor is growing just under your skin, throbbing and growing larger. The doctor comes, but instead of a scalpel or medicine, he takes out a piece of raw flesh. He places it on the tumor, bandages it, and whispers, "If this monster is hungry, let it eat you, instead of eating you." It sounds strange, but that was once a treatment. They believed that cancer was like a beast inside the body, gnawing at every bit of strength in the patient. If it could be fed from the outside, maybe it would be fool enough to let the person go. Today, when we hear it again, we might laugh at its naivety. But let's be honest, the idea is not entirely absurd. Cancer does have an insatiable hunger, and it has haunted medicine for centuries. The big question arose very early on. If cancer feeds on food, can it be starved to death? Let's go back to the early 20th century. A thin man, eyes bright with curiosity, stood before a maze of test tubes, culture fluids, and cumbersome measuring devices of his own making. His name was Otto Warburg, a German physiologist. He was haunted by a seemingly simple question: where do cells get their energy, and why do cancer cells grow so fast? By then, science had learned that all cells needed glucose and oxygen to survive, but exactly how they did it was still unclear. Warburg decided to measure it himself. He took pieces of normal tissue, placed them next to slices of malignant tumors in nutrient-rich culture fluids, and hooked them all up to a special device, a kind of barometer that measured oxygen consumption. The results left Warburg dumbfounded. Normal cells were breathing in oxygen regularly, just like any other living tissue. But tumors were using almost no oxygen. There must be some mistake, he thought. So Warburg added more sugar to the solution, as if to fuel both groups of cells. And when the experiment was repeated, the difference became even more obvious. The normal cells continued to breathe, while the cancer cells ignored the oxygen and focused on sucking up glucose molecules one by one. But then, a strange phenomenon occurred. When he added a drop of phenol red indicator, the culture solution suddenly changed color, from red to bright yellow. He knew something was wrong. Chemical analysis showed that the tumor was releasing a lot of lactic acid, the same substance that your muscles produce when you run at full speed until your legs give out. Only the lactic acid levels in the test tube were dozens of times higher than in normal cells. In other words, the cancer was eating sugar like crazy, but it was ignoring the most effective way to burn it. While a healthy cell converts a single sugar molecule into more than 30 ATPs through aerobic respiration in its mitochondria, cancer takes the shortcut, taking only 2 and discarding the rest as acid. It's a terrible waste, but it seems to be the waste that drives its insane growth. Warburg realized he had hit on a secret. Cancer is a disease of hunger, he wrote. Not a symptom, not a coincidence, but this disordered breathing, this return to a more primitive metabolic pathway, may be what causes cells to mutate and proliferate uncontrollably. The concept is now known as the Warburg effect. You can think of cancer as a sugar addict. It's willing to consume 4, 5, even 10 times more glucose than normal, just to grow faster. And for the first time in history, we're seeing that hunger with our own eyes. In the 21st century, with PET scan technology, positron emission tomography, doctors simply inject radioactive glucose into the blood. This substance travels throughout the body, and the scanner records where it absorbs the most. You look at the image, and you see a bright spot on the lung or pancreas. That is the tumor, shining as brightly as the brain or the heart, the two organs that eat sugar the most. It is not only growing, it is devouring every grain of sugar, like a red fire in the body. And this idea echoes a simple but dangerous question. If cancer lives on sugar, why not take away its sugar? Sounds easy. And indeed, dozens, hundreds of diet movements have arisen based on that belief. People give up rice, give up bread, give up all carbohydrates, and rush into a keto diet rich in fat and protein, hoping that if the blood has less sugar, the tumor will shrink. In the brochures, in the promises of health warriors, the vision is beautiful. You can starve yourself to death. But then clinical trials tell the cold truth. No tumor has shrunk on keto. No life has been extended by cutting out sugar. Whether it's the Budwig diet with flaxseed oil and cottage cheese, or the alkaline diet that promises to neutralize the acid around tumors, the outcome is the same: failure. The theories sound good, but the human body isn't that simple. The harsh truth is this: you'll starve before the cancer does. Because when the body is starved of nutrients, tumors have countless tricks to survive. They send distress signals to blood vessels, forcing them to grow new branches, a process called angiogenesis. They try to suck in fresh blood, oxygen, glucose, while healthy tissues wither away first. The weak fall, and the bad guys survive. Imagine you and your cancer go on a hunger strike. Who will fall first? The painful answer: you. That is why for decades, all the diet miracles against cancer have been disillusioned, and patients, in their despair, are left with fragile hope, even exploited by those who build an empire of lies, like Bale Gibson, who claimed to have cured cancer through diet, but eventually confessed that she had never been sick. Hearing this, you may feel disappointed. Does this mean the door is closed, that we cannot use hunger to fight cancer? No, the story is not over. In fact, just when all hope seemed lost, a coincidence opened up another path. Doctors accidentally discovered something strange in the PET scans. There were bright areas, not tumors, not muscles, but a special type of fat tissue: brown fat. The fat that seemed to have disappeared since we left the cradle. The fat that has the ability to burn energy like crazy, competing for blood sugar with anyone, even cancer. And it was here that a new door opened. Mentions a strange thing that doctors saw on the PET scan screen. It was not a tumor, nor was it a muscle in motion. It was a type of tissue that people thought only newborns had: brown fat. If white fat, the familiar thing that we still accumulate around the belly, around the hips, is an energy reserve, then brown fat is an energy-consuming factory. It does not store, but burns. It takes sugar, takes fat, and turns it all into heat. That is why newborns have a lot of brown fat, to keep warm when they cannot shiver to generate heat. However, scientists at the beginning of the 21st century were surprised. Adults also have brown fat, hidden in the neck, back, along the spine. Normally it is dormant, but just one agent, cold, makes it flare up, shining brightly on the skin screen like hot coals. To test this, researchers in Japan placed healthy volunteers in a 19 degrees Celsius room cold enough to trigger thermogenesis, but not enough to cause shivering. And as expected, brown fat glowed on PET scans, sucking up glucose from the blood like a hungry machine. The big question immediately arose: if brown fat could suck up sugar so well, could it also rob cancer of fuel? Scientists in Sweden decided to test it. They implanted tumors into mice, then divided them into two groups. One group was kept in a 30 degrees Celsius room, warm enough that their bodies didn't need to generate heat. The other group was put into a 4 degrees Celsius environment, cold enough to activate brown fat, but not enough to cause frostbite. The results shocked the research world. In the warm group, the tumors sucked up sugar, as usual, glowing brightly on PET scans. But in the cold group, brown fat resurged, competing with the cancer for glucose. The tumor was starved of fuel. After 20 days, the tumor growth rate dropped by 80%, and the survival time of the mice almost doubled. For the first time, people witnessed a tumor starved not by fasting, not by cutting off the whole body, but by an opponent right in the body: brown fat. Of course, that was just in mice. What about humans? In 2021, a group of doctors conducted an experiment on lymphoma patients. They had the patients sit in a room at 16 degrees Celsius for 4 consecutive days. It was not severe frost, but just a bit of cold that forced the body to activate brown fat. After 4 days, the PET scan showed two things: the brown fat glowed brightly, and most of all, the tumor's glucose uptake was significantly reduced. A small but extremely important signal. Brown fat can compete directly with cancer right in the human body. Imagine you have cancer, And instead of grueling chemotherapy, the doctor puts you in a freezing room, forcing you to stay there for weeks, even months. It sounds like torture. Your body is already weak. Now you have to endure constant shivering. A freezer therapy, effective, but not long-term. So science needs a bolder step. And that step comes from researchers at the University of California, San Francisco. They asked the question, is there a way to keep brown fat hungry without the cold? If we can do it, we will have an extremely powerful biological weapon in our hands. The answer lies in gene editing technology, CRISPR. Scientists began to learn from brown fat, finding important genes that help it burn energy. One prominent gene is called UCP1, a protein that specializes in opening valves for mitochondria to release energy as heat. They took normal white fat cells, then edited them with CRISPR to turn on UCP1 and many other genes characteristic of brown fat. The result was a new type of cell, no longer white, not quite brown. They called it beige fat. To test it, they let beige fat cells and cancer cells sit at the same table, sharing the same glucose source in a culture medium. And a miracle happened. Beige fat ate almost all the sugar, leaving the tumor to starve to death. The scientists were skeptical, thinking that the experiment might be wrong, but over and over again, the results were the same. Beige fat was so powerful that cancer had no place to stand. Next, they put the experiment into living organisms. From beige fat cells, they grew organoids, mini fat bags grown in the lab. Then they implanted those organoids right next to the tumor in mice. 3 weeks later, the tumors were removed for comparison. What they saw was like an unprecedented medical film. The tumors next to the beige fat shrank by more than 50%, while the control group continued to grow normally. And not just one type of cancer, but breast, pancreatic, colon, prostate cancers all starved by the competition with beige fat. The amazing thing is that beige fat doesn't attack the cancer directly. It doesn't secrete toxins. It doesn't send out a kill signal. It simply does one thing. It eats faster. It steals sugar right from under the tumor's nose. And in that silence, the cancer slowly dies. Scientists call this living cell therapy. And there's a reason it's so amazing. The material used to create this weapon is excess body fat, AS. Think of liposuction. Instead of throwing away that fat, we can take it to the lab, genetically modify it, and then put it back into the body as an army of specially trained cells. They integrate easily, are not rejected by the immune system, and get to work, outfeeding the cancer until it collapses. Of course, there are still countless questions. If cancer is starved of sugar, will it turn to fat to survive? If we put too much beige fat, will it cause metabolic disorders in the patient? Can the tumor cope by growing more blood vessels, pulling in more nutrients? But all these questions only show one thing: we have turned a new page. For the first time since Warburg, the idea of using hunger to fight cancer has convincing evidence. Not hopeless fasting, not blind dieting, but using fat cells, the softest tissue in the body, to become sharp weapons. Imagine a day when cancer is no longer attacked by chemicals that cause hair loss and body exhaustion, but by soldier fat drops that quietly lie next to the tumor, sucking up all its fuel. No bombs, no scars, just a silent death of starvation. It all started with a seemingly crazy idea by Ido Warburg 100 years ago. From phenol red turning yellow, from lactic acid rising in test tubes, he once believed that hunger was the Achilles heel of cancer. And today, after a century, generations of scientists are gradually proving maybe he was right. Science has always been a chain of hands. Some ask questions, some create tools, others do experiments. Generations follow one another, as if standing on the shoulders of giants. And who knows, one day, when medicine successfully turns fat into a weapon against cancer, we will remember this moment, when everything that seemed impossible suddenly became possible. At that time, perhaps history will add a line: cancer, after centuries of terror, was finally starved.